Pharmacology of the cardiovascular system, the blood flow through the kidney and nephrons. Lying just outside the glomerulus is the juxtaglomerular apparatus, or JGA. One function of the JGA is to regulate renin release as part of the RAAS system discussed earlier. From the glomerulus, the proximal tubule returns 60 to 70% of the sodium and water back into the bloodstream. From the proximal tubule, the filtrate flows into the descending loop of Henle and then the ascending loop of Henle. Another 20 to 25% of sodium is reabsorbed in the ascending loop of Henle, and this is the site of action of loop diuretics. Filtrate then enters the distal tubule, where sodium is actively filtered in exchange for potassium or hydrogen ions, a process regulated by the hormone aldosterone. This is the site of action for thiazide diuretics. The collecting duct is the final pathway. This is where antidiuretic hormone, or ADH, acts to increase the absorption of water back into the bloodstream, thereby preventing it from being lost in the urine. Nephron structure, elimination of drugs and hormones. Water-soluble drugs may be excreted in the urine and are influenced by one or all of the following processes: glomerular filtration, tubular secretion, or tubular reabsorption. Drugs that are structurally small can be filtered by the glomerulus with the filtrate. However, large drug molecules such as heparin or those that are bound to plasma proteins cannot be filtered and are not readily eliminated. Some drugs can be eliminated by carrier proteins that enable secretion of the drug into the tubule, such as dopamine or histamine. Blood and coagulation. Now that we have reviewed the functions of the heart, blood vessels, and kidneys, we will review coagulation. The primary function of blood as it moves through the blood vessels in the body is to deliver oxygen and nutrients and remove waste as it is filtered by the kidney. But that is only the beginning. Cellular elements of blood include red blood cells, RBCs, and white blood cells, WBCs, and platelets, and each element has its own function. Red blood cells carry oxygen, white blood cells assist with the immune response, and platelets are key players in homeostasis. The process by which the blood seals a small ruptured blood vessel and prevents further blood loss. There are 3 steps to the hemostasis process: vascular spasm, the formation of a platelet plug, and coagulation or blood clotting. Failure of any of these steps will result in hemorrhage or excessive bleeding. Each of these steps is discussed. Vascular spasm. When a vessel is severed or punctured, or when the wall of the vessel is damaged, vascular spasm occurs. In vascular spasm, the smooth muscle of the walls in the vessel contracts dramatically. The vascular spasm response is believed to be triggered by several chemicals called endothelins that are released by vessel lining cells and by pain receptors in response to vessel injury. This phenomenon typically lasts for up to 30 minutes, although it can last for hours. Formation of the platelet plug. In this second step, platelets, which normally float free in the plasma, encounter the area of vessel rupture with the exposed underlying connective tissue and collagenous fibers. The platelets begin to clump together, become spiky and sticky, and bind to the exposed collagen and endothelial lining. This process is assisted by a glycoprotein in the blood plasma called von Willebrand factor, which helps stabilize the growing platelet plug. As platelets collect, they simultaneously release chemicals from their granules into the plasma that further contribute to hemostasis. Among the substances released by the platelets are adenosine diphosphate, or ADP, which helps additional platelets to adhere to the injury site, reinforcing and expanding the platelet plug. Serotonin, which maintains vasoconstriction. Prostaglandins and phospholipids, which also maintain vasoconstriction and help to activate further clotting chemicals. A platelet plug can temporarily seal a small opening in a blood vessel, thus buying the body more time while more sophisticated and durable repairs are being made. Coagulation. The more sophisticated and more durable repairs are called coagulation, or the formation of a blood clot. The process is sometimes characterized as a cascade because one event prompts the next level in a multi-level waterfall. The result is the production of a gelatinous but robust clot made up of a mesh of fibrin in which platelets and blood cells are trapped. To summarize the 3 steps of hemostasis when an injury to a blood vessel occurs. First, vascular spasm constricts the flow of blood. Next, a platelet plug forms to temporarily seal small openings in the vessel. Coagulation then enables the repair of the vessel wall once the leakage of blood has stopped. The synthesis of fibrin in blood clots involves either an intrinsic pathway or an extrinsic pathway, both of which lead to a common pathway creating a clot. The steps of hemostasis. The extrinsic pathway. The quicker responding and more direct extrinsic pathway, also known as the tissue factor pathway, begins when damage occurs to the surrounding tissues, such as in a traumatic injury. The events of the extrinsic pathway are completed in a matter of seconds. The intrinsic pathway is the longer and more complex. In this case, the factors involved are intrinsic or present within the bloodstream. The pathway can be prompted by damage to the tissues or resulting from internal factors such as arterial disease. The events in the intrinsic pathway are completed in a few minutes. The common pathway. Both the intrinsic and extrinsic pathways lead to the common pathway, where fibrin is produced to seal off the vessel. Once factor 10 has been activated by either the intrinsic or extrinsic pathway, factor 2, or the inactive enzyme prothrombin, is converted into the active enzyme thrombin. Then thrombin converts factor 1, the soluble fibrinogen, into the insoluble fibrin protein strands. Factor 8 then stabilizes the fibrin clot.